Hey, everybody, welcome. Here we go. A special bonus hour number 4 of Matt Connarton Unleashed. Today it is August 30th, 2025, and we are live at 3 p.m. Eastern. And of course, whether you're tuning in live, if you are tuning in live, feel free to chime in the chat room. We have a very special guest we're going to introduce in a moment. And if you are enjoying this in the podcast feed after the fact, welcome. It is a holiday weekend, so I don't know how many live listeners and or viewers we'll have, but I know a lot of people are going to be checking out the podcast of this. Jenny is here, of course. She is not at the news table because we're not at the radio station, but
I am
she
at
is
my
at
creative space.
You are, yes, you are at a table of sorts. And joining us live on the show, we have Karishma Manzur, a New Hampshire candidate for the United States Senate, challenging for the Democratic nomination. And hello, Karishma.
Hello, Matt.
Well, it's
Hello.
nice to Oh, sorry. Go ahead.
Hello, Jen.
Good afternoon.
Good afternoon.
So it's nice to have you here. We were, of course, Jenny and I were recently at your event at McIntyre here in Manchester, making your official announcement. And Jenny spoke there, as well as there were a number of great speakers there that day. And of course, and you spoke and announcing your candidacy. Why are you? Well, let's start here first. Tell us a little bit about your background, if you would, and then I want to know all about why you're running. You're certainly an underdog in this race, of course. We'll get into all of that, but tell us a little bit about you and your background.
Sure. Thank you. First of all, thank you, Matt. Thank you, Jen. And thank you for all the listeners. I truly appreciate that you guys are giving me this opportunity to reach other people across New Hampshire. Let me see. Who am I? So I'm Karishma. I live in Exeter with my husband, my 2 children. I'm a scientist by training, and I've been working in clinical research for about 20 years, over 20 years now. So clinical research, my work has involved finding treatments for various illnesses. I worked on Alzheimer's disease at one point, but the last few years I was mainly focused on epilepsy and depression. And I loved my work. I love being a scientist. I love doing clinical research. It is just so gratifying. You don't end the day saying, oh, another 8-hour day or 10-hour day or 12-hour day. You just absolutely love it because you know that whatever you're doing, whatever the workload is, it is always helping people. So it's a form of public service, Matt and Jen. Mm-hmm. It is a form of public service because scientists, we don't get rich. Yes, we don't get rich. We don't go in for the money. We go in because we care about people and we want to help them. Mm-hmm. So, but over the course of the last couple of years, I started to get a little sad because every time I would hear, wait a second, so we have all these great treatments, we have all these wonderful research going on, but what will happen to these treatments? Will people be able to access it? And yes, many millions of people are able to receive treatment. But it was disheartening to realize that millions of Americans don't have access to an adequate health care, or they don't have access to, they might have private health insurance, but they can't afford the copays. Mm-hmm. And so I started to move away a little bit, started to think, wait, what's going on? Why is this happening in the richest country in the world? Matt, we live in the richest country in the history of the world.
Yes.
So why are millions of Americans suffering from various ways? But I was focusing specifically on healthcare at one point. And it's not because lack of resources. It's because it's deliberate. Matt, it's deliberate. It's by design. It's working exactly how people want it to work. The lawmakers have been basically leaving us behind for decades. Mm-hmm. There are really great fighters over in Congress, many great fighters, but the majority actually are not interested. They're corporate politicians. So as long as their donors are happy, as long as their own portfolio is doing well and their stock options, they're actually doing quite well. Whereas here on the ground, people, and it's beyond healthcare, like the fact that we have our minimum wage is stuck at $7.25, it's really terrible. Absolutely. It's horrifying what we are doing to people. Childcare is a serious crisis right now. There are so many families who just can't afford $1,500 or $2,000 childcare per month when they're working It's terrible.
Yeah.
And so what do you do? Like, do I go back to work? But I can't afford it because most of my salary is going to go to childcare. So is it worth it? What a terrible decision. And then the housing crisis, Matt. So as more I started to move into the legislative field, I started to understand, wow, there are all these crises that we hear about, we read about, but those are not impossible problems. Those are not problems that as a government should be able to predict what's going to be needed. Population's growing, we'll need more housing. Families need childcare. Cost of living needs to be managed. Salaries have to keep up with inflation. And over again, I saw these wonderful pieces of legislation that have been introduced in the House and the Senate, and it barely gets enough co-sponsors. So that's how I started to move away from research into nonprofit sector, then into the legislative work. And we came to a decision, many of us from the nonprofit sector, that it's not enough just to elect a Democrat. We have to elect the right Democrat. And so here I am.
Wonderful. Jenny and I, you talked about how our health insurance system works or doesn't work. And, you said something that I often say. We live in the most prosperous, most innovative, most successful country in the history of the world. And yet we somehow can't make sure that everyone has access to adequate or preferably better than adequate healthcare.
Mm-hmm.
It doesn't make any sense. And the reasons you laid out for why that is the way it is, it's true. And it's, if I always say, if we had, and we'll get into I don't know exactly where you are on this, but I've always advocated, and Jenny and I talk about this a lot too. If we had single payer health care, because people say, well, where would the money come from? It's like, well, the money's already being spent. If you had single payer, now your employer doesn't have to pay for your health care. Now your employer doesn't have to deduct money from your paycheck to pay for your health care. So the money's already there. But we could just get rid of the whole, because the thing about health insurance companies, and I like to be a little more blunt about it than most people are, to be very blunt.
Go for it, Matt, and let's hear it.
to be very blunt,
yes.
The health insurance company only wants you around.
Yes.
As long as you are an asset, as long as your premium's getting paid every month and you're not costing them money. Once you move from being an asset to a liability, you're now costing them money. The insurance company then at that point would prefer that you die. It's purely a business.
It is disgusting to think about it, but Matt, exactly.
It's true, though. Yeah, it's true.
It's horrific. Oh my God.
Yeah, but they want you to die at that point.
And that's the reality we're all living in, right? And anybody who knows me knows that I've spent years now advocating and trying to help people get the health care they need, that they're denied by these arbitrary systems. And the thing is that the usual excuse is, I don't want government-run healthcare, but that's not what it is. We're not talking about socialized medicine.
Right.
We're talking about what exists in and I don't know, Matt, you and I are going to have a debate about what's the best country in the world, because I think I don't think you're right on that one. Because I got to be in other places, and I was. Well,
that's not what I said exactly, but
in the Netherlands, everybody has access to healthcare. Whatever it is that they need, that the doctor orders, gets ordered. The cost is minimized because there isn't all this bureaucracy.
Right?
The doctor says you have X and need test B. Okay, you get that. They say you need this drug. And it goes to the pharmacist, and the pharmacist delivers it to you. And that's the end of the friggin' story right there. As far as how, and it's cheaper. There's no billing crap. There's none of this. I mean, I had a provider that had to hire a new staff member to do nothing all day, every day, but Blue Cross Blue Shield denials of care for therapy, for mental health therapy. Should be something easy to get through insurance.
So this was a full-time job, Jen? This person's, my God.
Yes. The business was in Concord. This is here. Business was in Concord, and they already had billing staff. They had to hire another staff member to do nothing but Blue Cross Blue Shield denials.
Wow.
Never mind the other company denials.
Wow.
Right. So this is what we're living with, and it's not that. So if it's insurance works by, we all pay into a pool.
Yes.
And then that pool pays the bills.
Yes.
We all pay taxes.
Yes.
This is our money.
Yes.
It goes into the Medicare fund that's supposed to pay the bills, not give United Healthcare enough fuel to use their Gulfstream jet because they don't want to fly with the peasants, utilizing our government to protect those profits. I need somebody in the Senate who's going to stand up to that because nobody's doing it for me now. I was getting treatments covered by my insurance company, but since the new regime take over, they have now said that though I am not cured and there is no cure, they're no longer medically necessary. They called and told me that, would not put it in writing, but will not give me a prior authorization, so I cannot get the treatment unless I pay cash up front. I've tried to get help and I've got crickets. And CMS, Center for Medicare Services, is supposed to keep their feet to the fire and say that the law says you do X, that's what you do. That's their job, to enforce those laws and make sure things are done right. I got crickets. I got no, you know what they told me? CMS literally told me to try another insurance.
Oh my God.
Or to see a provider who doesn't offer the treatment that I need. Because the provider that they have or in network don't do these treatments. So I should give up treatment or just hang out until next year and try another insurance because, you know, illness lets you just hang out, right? You know that as a scientist, don't you? So if we had, like, when you talk about Medicare for all, people say government funded healthcare. That is absolute bullshit. That is bullshit. That is taxpayer funded, just like your insurance is now. You pay into the pool pays the bills. So if Medicare is accepted in most places and the doctor bills Medicare and Medicare pays the bills without all the crap that goes on now, so there's not that overhead, not that cost. The cost of healthcare comes down. Medicare is accepted by most everybody. So you have access to everybody. So you don't have network constraints, state line border restraints, right? So the kind of healthcare you're talking about makes it accessible for everybody and puts everybody in the same playing field in that you need chemo, you get the chemo. The insurance company doesn't get to say, you need to try the cheaper version first. And then when that fails and it's too late to try the one the doctor wanted you on, you die sooner. So you don't cost them as much money. And I know that that's what my health insurance company, United Healthcare, is hoping that I'm just going to kick off because they're not going to cover it. Well, I'll do what I always do. I'll pay for it my damn self because they're not going to win.
No, they're not. Right.
You know, but it shouldn't be like this. And we shouldn't have to fight those battles. So that's one of the very biggest reasons why I was so happy to endorse you as a former state representative, as a former Republican. You're everything that I need up there to ensure what you want to bring to the table will save lives. What's going on up there right now and the status quo. And I'm sorry, but your counterpart supports Medicare Advantage, which is destroying lives and killing people. And that's exactly what's doing it to me.
Right.
And I've tried so hard with letters and phone calls and meetings and trying to say, please listen to us because we're hurting out here. And yet the status quo politicians up on the Hill keep signing off on Medicare Advantage and increasing the amount of money these companies get in profit out of tax dollars, Medicare tax dollars, while increasing our costs.
Well, let's let Karishma talk about.
But you guys brought up so many great points. Okay, I don't have a piece of paper. I should have taken notes. So I'm going to try to remember. First, Matt and Jen. First of all, my God, you guys are. The information that you guys just shared, you have to talk about it all the time, out there, everywhere, because most of us don't even know about these things.
Right.
Until suddenly we lose, we lose our employment, or we get older, or we are now some other disadvantage. And then you realize how messed up the system is. But we cannot wait until people are in their most vulnerable and then have to experience these terrible situations. So what you guys talked about, please talk about it over and over again with everyone. Let's get that message out. And Matt, what you said, I mean, it kind of was chilling. You called it, which is actually true. We are either assets or a liability.
Yep.
We're a commodity.
Yep.
How disgusting. So why? Because it has become, healthcare should not be for profit. Good God, healthcare should not be for profit. And that is exactly what the model we have. And so one thing I would like to say is, look at our fire services, the first responders, whether it's the fire services or the police force. They are not for profit. We pay into for these services, and God forbid we don't need it. But the day we may need it because there's a fire in the house or a burglar is breaking in, I'm so glad that we have a fire department in my town and a police department in my town.
Right.
Healthcare should be like that, not a for-profit service. It should always be there. And when you, God forbid, if you're ill or you get into an accident, you have access to it. And it shouldn't, and Jen touched on this, the amount of money we're wasting on the bureaucracy. Jen, I looked this up. 34% of what we spend on healthcare, 34% goes to bureaucracy, not to paying for medicine or treatments or devices or the physicians, just bureaucracy. And like you said, you walk into a doctor's office and, the receptionist is in the front checking you in, but you'll see 2 or 3 people are working in the background.
Oh, yeah. Yep.
All they're doing is fighting with health insurance. Mm-hmm. It's a legitimate doctor's office. It's a primary care. They're going to most probably order blood tests, maybe some other tests. And they're going to sign up a physician, an MD, who has gone to medical school, who has done the internship, who has done the residency, who has years of practice, has to basically fight with the insurance company, someone somewhere, maybe in the Philippines, somewhere, who will be like, no, I don't think so. I don't think that test is required. Who are you?
Right.
What medical degree do you have? We have to talk about it loud and clear. We have to inform people, and we have to say, this is unacceptable. And why is it? Why? So we are now the only developed nation in the world, not only the richest, but we also have another way we're sticking out. We're the only developed nation that does not have a universal health coverage.
Right.
And that is embarrassing. It is embarrassing.
Yep.
Yeah.
And not only that, we associate it with work only. So
when
you get sick and you can't work anymore, you lose your health.
Yeah.
That's what happened to me.
Right.
I was a full-time healthcare worker. I had multiple jobs, but I got breast cancer, and that trashed my whole life. Right. Yeah. And it wasn't any fault, but exactly that, right? Like we associate it with your
illness
job.
Away. Yeah.
Yeah, exactly. And the minute you're sick, it's like, well, if you can't make me money and you can't serve me, I got no use for you anymore.
Yeah, exactly.
That's America.
It's really wrong. And then a lot of times it stops a person from moving to another job. They're like, I don't like my job. I want to see an advancement, but I have that health insurance. Like it really holds people back.
Oh, yeah.
It does.
So from the employee perspective, you're like, I really want to try something else. Maybe I want to take some time off. Maybe I want to start my own business, but I cannot afford health insurance on my own. And I think, Jen, you touched on it, from the employer's perspective, it is draining them. Every single year, the premiums keep going up and up and up. It is absolutely terrible. I've talked to small business owners who are afraid to hire more people because they just can't afford it.
Right.
And like Jen said, you lose your insurance when you're sick. But another thing that happens is, say you are 40, maybe a 50-year-old or a 60-year-old, and you're still working, and you try to get a job. The employer will look at your age and say, this person might cost me more, because my insurance company will say, we are spending a little bit more because your employees have more illnesses. Your premium's going to go up.
It's a good point.
That stops employers from hiring a 50-year-old and 60-year-old. You'll see people will say, it's impossible to find a job now because I am at a certain age. So it makes no sense what we have. It is absolutely horrible for individuals. It's horrible for employers. It's horrible for the people who get sick. We need to, let's say, okay, so we have established it's a broken system. So I'm a scientist. Jen, you are also coming from science. Matt, I don't actually know. Matt?
I'm very bad at science. Math and science are not my friends, but that's why I trust people who know about science.
Okay. So Jen and I are both coming from the healthcare field. So we have this kind of like, we are pragmatists. We're practical. We're like, okay, there's this problem. Let's figure out the problem. what's causing the problem. Let's look at solutions and implement the solutions. And it's very simple, right? It's like, for us, it's like, it's a no-brainer, but obviously it's not a no-brainer for a lot of people, or maybe they're too corrupt to be no-brainers for them. Okay, so what is the solution? Let's talk about the solution then. We need one single healthcare plan that is not going to be for profit. We cannot have, and that is not going to have 34% spent on bureaucracy. We are going to have one single payer system, which will cover every American across the country. And what is that system called? There's only one plan out there, which is Medicare for All. Now, the word Medicare is being used way too many places, and I think it has to scare people. So there's
100%.
And this is, Jen, I'm going to try to explain it, but I know you're the expert, so please chime in, because you have taught me so much about Medicare. Folks, if you have any questions, ask Jen. She's like, I swear, she's brilliant, and she's an expert. All right, so Jen, help me out. So there's the traditional Medicare, which is the Plan A, Plan B, and Plan D. Okay, so that is available to people when they hit 65.
Yes.
70, or you can.
Currently 65. My generation is switching to 67.
67. Okay.
Or if you become disabled.
Right. Okay.
Or you're born with. Sometimes it happens for children. If you're born with some kind of a disability, you may have Medicare granted right out of the gate as your baby.
That's true. Okay. Now, Medicare Advantage, we should not use the term Medicare because that abuses the word Medicare and throws people off. That is that typical marketing scheme to use a good word and, don't do that. Don't do that.
And that's one of those bills you were talking about that's sitting in the Senate, just stalled, that's supposed to forbid them from being able to use that term. So they can, because so many people, especially older folks, get tricked. In states, especially where they can call you and do everything over the phone.
Yes.
I mean, and that's so just stalled.
But now Medicare Advantage, it uses the term Medicare, but it's all for-profit insurance companies are part of that, right?
Yes.
Oh, okay. So that's where it's no longer a controlled environment. Now you've gone into the for-profit sector, and therefore you are now, they are now going to cover this treatment, or they're going to need pre-authorization. And then it becomes that whole complexity. And it is no longer about the patient and their provider. It becomes about a CEO and their profit margin.
One of my specialists has staff that do nothing all day, but sit on the phone getting prior authorizations for every single treatment done.
The other day I was at the doctor's office and I intentionally talked to them. I was like, I need to talk to you guys. How long does it take you to get authorization? They're like, every single insurance company has its own system. Some are over the phone. Some are like this complicated computer system. Some are a little bit easier. And they said, sometimes I can be on hold for an hour. One patient, one procedure on hold for an hour.
Yep.
Think about how annoying and how grotesque that is. It is so wrong. So then, so now, okay, but we are feeding, so at the moment, our whole healthcare system costs $5 trillion. $5 trillion. That's with a big T. Medicare for all, which is different from traditional Medicare, because, okay, I should talk about it a little bit just before I go into the finances. Medicare for all builds on traditional Medicare, but the advantages, I should not say the word advantage. Okay.
Jenny calls it Medicare disadvantage.
Okay. We're not talking
about that one.
We're going to get to that one. Part C out. Okay. Medicare for all builds on the awesome Medicare system that we have, but it includes dental, vision, hearing, and long-term care, which is not part of traditional Medicare. Because those are extremely important services.
That's another thing that we do that other countries don't do. They take eyes and teeth are part of your body. So like, that's, this is an important part of the healthcare too.
Yeah.
But here, not so much.
Yeah, that is strange.
Even though a tooth bacteria can cause a fatal heart condition and take your life.
So I had a tooth removed, not to get too personal here, but I need a filling. It's going to cost me $5,000. I'm like, no, I think I'm good.
Oh my God.
I'm
You
good.
gotta go to my dentist. We'll talk later.
Some people said go to a foreign country and get it done. It'll be cheaper.
That's what
that's
people
what
do.
Americans are doing
That's
because
what some
they
people
can't
do.
get
Yeah.
healthcare at home. And to touch back to what you were saying about how all of this is integrated. So that doctor is paying for that staffer for an hour's salary to sit on hold, plus matching their taxes and paying their Medicare and paying their all of that cost to hold on for prior authorization. Now, if you just got to do the treatment, what's the cost of that? And how many more people are available to actually take care of patients instead of pushing pencils?
Exactly. Absolutely. So now, so that $5 trillion system, if we transfer, we get rid of all those for-profits, we get rid of all the CEOs' money and the Wall Street's making huge amounts of money. Oh my God, Wall Street is so happy with the broken system. And we get rid of the bureaucracy and we just hold on to that $5 trillion system. Medicare for all will be $650 billion cheaper than that $5 trillion system.
Exactly.
Light bulb.
And if we think about our history too, oh gee, politicians stole money out of the Medicare Trust Fund. How about, wouldn't this put money back into it and get healthcare to more people at a better price? Like there's so much about that just snowballs.
So Jen, why don't we pass it? Why are we the only nation in the developed nation that doesn't have that system? Even though we have, let's talk.
It's the lobbyists. They have a multi-billion-dollar industry. They spend millions and millions of dollars on the Hill. Yeah. I watched as it happened when we tried to fight that money shouldn't get increased to these health insurance companies, with the $25 million CEO salary, right? And they're cutting our benefits. Like this year, Medicare Disadvantage cut dental care except for cleanings and x-rays.
Because those are cheaper.
So what happened I thought this was about giving us more benefits for this cheaper cost. But here's the thing. You know that Medicare Disadvantage, those companies, United Healthcare, Aetna, Blue Cross Blue Shield, they make millions and billions. They make over United Healthcare makes about $8 billion every 3 months in profit. And a ton of that is Medicare dollars because they make more money on Medicare Advantage patients than they do anything else. Because first of all, they get like a flat month for getting you once you signed up on theirs, they get money for you. Now, every time they add a diagnostic code that makes you sicker, they get more money. The sicker you are, the more money they get. If they keep denying and delaying your care, they're not spending it, they're pocketing it. And that's exactly what's going on. And I will tell I know I've said this to you before. I don't want to say it on air. I've asked so many politicians, tell me one thing that health insurance companies do to increase positive outcomes in any healthcare case.
I know.
And only one tried to answer me. He's like, they collect data because we don't have enough universities and medical facilities and actual doctors and nurses and scientists to do that. We need some bullshit artist sitting in some office with his $3,000 suit.
Yeah.
Flying his Gulfstream jet over to his friggin' yacht on our Medicare tax dollars.
Yeah.
And that's why Medicare Advantage is absolutely freaking horrible. And it's one of the biggest fleecing of America that has ever happened has been Medicare Advantage and how much money these multi-millionaire, billionaire people are making on the backs of the working poor while they're denying them chemo, denying them care. I mean, you remember the doctor that wrote the letter yelling at them for denying a kid with cancer, the Zofran for the nausea, how guttural that felt to read that doctor's letter. Like no doctor should ever have to do that. I've watched doctors on the Hill practically in tears in front of committees to senators saying, please, I have children with cancer that need access to this drug. We're supposed to have orphan disease access. Why don't we have it? And the politicians. That's why I think a scientist on the Hill who understands the real ramifications of these decisions.
Yes.
I want somebody up there who actually knows that when you don't pay attention to this, people die.
Yeah, exactly.
There's another reason. Nobody ever talks about this part, but I think there's another reason why Americans tolerate such a broken healthcare system. We're conditioned from a young age to accept and to believe that we have a great healthcare system, because when you're young and you're healthy, and if you're like, I remember being, young and knock on wood, I'm still healthy even at middle aged. I haven't had anything catastrophic go wrong. I'm lucky. But when I remember being young and having a full-time job working for a company that had what I assume was really good health insurance, because I never had to use much of it. And, so you get conditioned to, okay, I'm young, I'm healthy, I've got a job. Oh, I'm sick. I'm going to go to the doctor. I might have a small copay, whatever. I've got health insurance by my company. I'm covered. I'm never even going to see a bill. I'm going to pay the copay, and that's it. And then go on with my life. And, assuming nothing terrible is wrong with me, take whatever antibiotic, whatever, and life goes on.
Yes.
So you're conditioned from a young age when you first enter the workforce that everything's great. Everything's easy with healthcare. And if you're lucky enough to have health, well into middle age and old age, then you might go your entire life without even a clue that there's anything wrong in the healthcare system if you're one of the lucky ones. But we're conditioned from a young age to believe that the American healthcare system is great because, unless something bad happens to you, God forbid, you have no way of knowing.
Right. Exactly.
In the rest of the world, they're doing preventative medicine. Here, we're doing cleanup.
Yeah.
Well, that's another issue too. There's not enough, but that's.
Yeah. God.
Because of exactly that, the conditioning. You're conditioned to think you only go to the doctors when you don't feel good.
Right.
You don't talk to the doctor about how to be healthy. And the doctor doesn't have time to even do it.
And let's talk about some of the problems. Okay, I'm going to give you real life examples, and I'm sure Matt and Jen, you guys can also add many more. I'm just going to give you, here in Exeter, one of my best friends, he's 76 years old. He's done everything in his life, whatever he needed to do, paid taxes, had a job, raised 4 kids. Now he's retired. He receives Medicare. He has Social Security, and he's a small pension. He's on fixed income. It is, he has to be very careful. But of course, as he's aging, the opposite of the scenario that Matt just talked about, which is like, oh, everything's great. I go every so often. I don't have a lot of problems. Well, when you're hit your 70s, even if you were fine all your life, now, of course, things are starting to slow down. Your heart might need some support. Your blood pressure medicine needs some support, etc. So he needs blood thinners. He has atrial fibrillation. He needs blood thinners. Otherwise, he's going to form blood clots. Medication costs a lot of money. He has Medicare, but the copay is high. So what did he do? He decided to ration his medicine. He started to skip 1 dose because 2 tablets a day, maybe I can get away with 1 tablet a day. My friend suffered a stroke.
Yeah.
In the richest country in the world, a 76-year-old man who did everything by the books, taxpayer, everything, he suffers a stroke.
That is so wrong.
It is so wrong, Jen. It is so wrong. Let's scream that every single day to everyone. It is wrong. That is the status quo, and this is unacceptable, and we should not accept it. We should inform people and say, no, don't let the lawmakers fool us and say, oh, yeah, but we're better than that other country. We're better than that other country. So I'll get to that because I used to buy into that criticism as well. Like, oh, are we then better than the other country? But at least my friend did survive. He stayed in the hospital for several days. He was released. It does not appear that he has any permanent issue. So it's good. But lucky.
But now he has a hospital bill.
Well, that's But he could have become one of the statistics. We lose 50,000 Americans each year because of health insurance issues. Either they don't have insurance or they're underinsured because their issues, something's going on in their body, but they can't afford to see the physician. I mean, when you have a limited amount of money, the first thing you do is pay your rent.
Yep.
You do not want to become homeless. Second thing you do is you have to feed your body. Even with canned food, bulk purchases, you can only stretch that dollar so much. And maybe third, you fix your car because you got to get to work or you have to do it. And then maybe clothes. Healthcare becomes a luxury.
Yep, exactly.
Shameful. Shame on us. Shame on us that we find this acceptable, that we're torturing people in this
But isn't
country.
that what Matt was talking about, right? We're conditioned to it. And
Yeah.
that's why
let's break
that's
it.
why I'm happy about your campaign, because
Break that status
these
quo.
conversations need to be happening louder, prouder, and up on that hill and
Up on that
changing
hill.
things. For once and for all, let's freaking change things for the better,
Mhm.
because this is getting worse every single day.
Every
And now they're
single-
just saying now we're going to introduce prior authorizations into traditional Medicare.
Oh God.
Using AI. That's the new regime twist. They just announced that. So, obviously that's going to be something they have to fight again.
They just want to squeeze as much money out of us as possible in every single way. And we are just, we have to just go along, be like, oh, this is normal. Oh, aren't we still better, etc. I'll give you one more example, because I listen. I talk to people and I ask them, what do you want to see? And tell me what is going on in your life. And the stories you hear, they're heartbreaking. Another person said her loved one needed care. It was authorized by their physician, but their insurance company wouldn't pay for it. That their loved one died. The same year that they lost their loved one because the health insurance company, she had a private health insurance company, was not authorizing it. That same year, the CEO of that insurance company made $19 million. That, Matt and Jen, is blood money. That is medical murder. We have to talk. How can we even have a term, medical murder? That is disgusting. This is like mass murder is going on. Let's face it. Let's call
100%.
it 100%.
Absolutely, it is. It is. When you deny people surgeries to save their lives or medications, and your friend had a stroke that was preventable, and what damage was done was done. There's going to be ramifications for that. We all want to live as long as possible, and I don't care if you make $7 an hour or $17,000 an hour. You like. It's crazy that person's life gets to be more valuable than somebody else's. You're working class Americans are busting their humps every damn day. Everybody I talk to is co-living because they can't afford to live alone, or having a second job, or even a third job, because the groceries are insane right now, on top of everything else, that they're barely surviving as is, and they want to take more and more and more and keep denying care, and they just kill people off.
You feel like squeezed. They're just like blood suckers. What more
can people feel like you're worthless? Like, my life doesn't matter anymore. I've rationed my care. My life mattered when I was an EMT and I worked in the hospital, but after I got cancer and couldn't do that anymore, I guess it doesn't matter anymore now, because now I have to fight for treatments or deal with just figuring out the cost for myself, for medications, whatever. And that's Medicare disadvantage. That's what I'm stuck on. Unless the government changes, I'm stuck. And so many other people out there are just like that. And like you said, they get denied home care. They get denied long-term care, short-term rehab care, so they can have a life again. I have a friend who lost her dad, who was denied rehab care. It's disgusting, and it's because the people on the Hill are allowing it to happen. Bottom line, they allow it.
Yes. So you guys have an awesome platform. You have to spread the word. Okay, you cannot talk about healthcare every day, but you have to.
I know, I feel bad that we've monopolized that.
No, it's okay. But the same formula that's causing that hardship with healthcare is actually the same formula that's impacting us for the housing crisis, the childcare crisis, the cost of living crisis, many ways. So the minimum wage. So let's also talk about other ways people are suffering. So here in New Hampshire, we have such a dire condition as far as housing is concerned.
Big time.
Big time. We have 24,000 units short right now, 24,000 units short in a population of 1.4 million. Wow, that's huge. People, I think that I looked at the inventory rate for certain municipalities. Sometimes it's as low as 0.5% or 1%.
Yeah.
Vacancy rate is like, it's almost not there. So when you want to move from one apartment to the other, well, you don't have an option. And the expense rate is so high. So again, I'm going to use examples because that's exactly how I understand to explain the gravity of the situation, right? Here right here in Exeter, a friend, she was talking about her grown daughter. I call everyone a friend. I'm sorry, but when you have these raw conversations,
right, there's a connection there.
There's a connection. You're like
that kind of personal pain.
Exactly.
I get it.
Yeah, you just, to somebody to tell me how much they take out their bill. Like, come on, Karishma, let's talk about my bill. I want to show you my copay. So, or they want to show the condition of their house. They need some repair, but they can't afford it. So you become like, okay, that's really raw conversations. These are not like, hi, hello. These are real conversations.
Yeah.
So this person, she's 77. Her story is also terrible. So I'm going to touch on that. Or not terrible in the sense, but it's difficult, I should say. But her child has a job. She's in her 30s. She has a good job. She can afford an $1,100 in an apartment, which you would say is not a bad amount of money. $1,100 is a good amount of money. In Exeter, she's renting a basement space. It's not an apartment. It's a space. There are no windows. There's only one door to the main, stairs to the main floor, which means if there's a fire, she's stuck. There is no other exit. It's illegal. Basically, it's an illegal space. But that's what she can afford.
Yeah.
There's no heating. There's no cooling. So she has to have, space heaters. She has to have air conditioners because that's just an unfinished basement for $1,100 in the richest country in the world.
Mm-hmm.
And someone who has a good job. She has a good paying job. We're not even talking about minimum wage now. This is a person who's actually making good money.
Yeah.
This is what they can afford.
Yeah.
Is that acceptable, Matt?
No.
We should not accept the status quo. The lawmakers want us to say, oh, things are bad, but, whatever, national security, oh my God, crime rate, oh my God.
Whatever they can distract us with.
Distract us. Oh yeah, let's hate those people over there. Let's marginalize another group. But don't pay attention to your real problems. So, and that.
What's the solution, Karishma, on that? I mean,
housing prices. Good question. Yes. Yeah. Let's talk about. Okay, we will try to touch on an issue. We will try to touch on the root cause, and then we'll try to touch on the solution. So, what is the root cause of the problem? Why do we have a housing crisis? Simple. We just don't have enough houses.
Yeah.
Right. Okay. Is that, first of all, how did we get to this situation? The government's job is, we have pretty smart people working in the government, maybe not at the top, but they're really good government workers out there. They are supposed to calculate, we are increasing, the population's increasing, even though New Hampshire, we're not growing at the rate of many other states. And because we're losing a lot of young people are moving out. They just,
they graduate and they leave. Yeah.
Yes. But at the moment we are still seeing people moving into New Hampshire. But the rate of growth is slow, but we're growing. So we need more housing.
Yeah.
So what are the problems? One is those Airbnbs. So it has taken out a lot of housing off the market because they are not. Go ahead.
That's true. I never thought about that.
Yeah, that's interesting. Yeah, it never occurred to me.
So it's not the main problem.
No.
But it is a problem. Because if you go to, for example, Rye Beach, or you go to a lot of these places, those houses are just sitting there empty until the weekend or maybe a Labor Day long weekend. That's it. Otherwise, that's a housing unit. As far as the state is concerned, there is a certain number of housing units, but it's not occupied.
Right.
The other is second or third homes of people either living in New Hampshire and they own a second or third home, or people from out of state who own a second or third home in New Hampshire. And we have to deal with those in a different way. But that's again, you're taking a housing unit off the market, right? But you're not using it 100% of the time, but you're taking it. Okay. And corporations have also come in, they're landlords, and they're also purchasing a large number of these like these apartment complexes. Okay, that one is not necessarily taking housing off the market, but they are definitely causing a rise in the price. Okay, the one biggest way we can help right away, Matt, first of all, we have to do something about all these housing units that are not used all the time. We have to find a way for people. I mean, okay, let's not talk about that. The biggest problem is we have a low inventory. We have to build houses. We have to use USDA funds for rural. They actually have the USDA is U.S. Department of Agriculture. They actually have rural housing funds for communities that are in the rural north. For example, our North Country will qualify. Some parts of the West. Western towns will qualify. We actually can use USDA funds to build houses there. The other is HUD, Housing and Urban Development. They actually have, these are federal dollars you can use to build units. The state has to work with it because the state, you need space. And if it's owned by the city or it's owned by the town, then there are a lot of rules and regulations. You can work with the city and town to figure out what can be built, what is allowed, and hopefully multi-unit complexes, because then you're utilizing a space better. But there are also state-owned spaces, right? You can also use that because then you don't have to worry about the rules and regulations of each town and each city. So if you want to look at two towns that are doing really well with this multi-family, multi-unit system, it's Portsmouth and Dover. Portsmouth and Dover. They're doing really well. So they have single family homes. They have, whatever people want to always protect their little single family home acreage. But you can also have townhomes or you can have apartment complexes, maybe multi-story. You have to have mixed use. And then within the downtown area, maybe you can have like the bottom floor is all about businesses, restaurants, and stores. And the top units are all apartments. That's how we have to build. Right now, the only thing that keeps getting passed through Congress is one program called, and I don't want to go all boring on you guys. Okay.
No, you're good.
It's called LIHTC. And I want to make sure I get the acronym right. Low Income Housing Tax Credit. Yeah, LIHTC, LIHTC. That's really popular. If you look at the LIHTC related bills that are in Congress, they get a bipartisan support. What is that LIHTC? It sounds like a great idea. Oh, we are good. Look, as far as lawmakers are concerned, they can say, I've sponsored this wonderful bill to help with the housing crisis. And then you look at the bill and you're like, oh, okay, that's a great, that's a good piece of bill. But what is happening with LIHTC? It gives tax credits to developers. Oh, I'm going to bore all of you. Sorry.
No, I'm glad you're going down this road because I'm actually a big fan
I do want to understand.
I'm a big fan of using the tax code to stimulate.
Yes. True. But so you give tax credits to the developers and you say you are eligible to receive this tax credit if you build a complex and you put away a certain number of units and consider them low income housing. And then the developer says, okay, great, I'll get some government subsidized tax credits. I'm going to build it. What happens is it's a 2,000-page code book. Developers hate it. They don't like it for two reasons. One is it's way too complicated. And the second reason is that tax credit is going to work over 10 years. And the developer who's building that housing unit now needs the money now, not over the course of 10 years. Yeah. So what they do is they may still accept it, but then they turn it around and sell it back to Wall Street or to the bankers. It's another way to siphon federal money and back to Wall Street. That is why it's so popular. That's why it gets bipartisan support. It's like,
oh, yay.
Hey, big money. We're like, hey, we love this LIHTC. Anyways, but the other thing is, if you look at, because of the codes and the regulations are so complicated, like I said, a lot of developers just shun away. But the ones who even still take advantage, the cost of each unit on a LIHTC funded unit versus a non-LIHTC funded unit, it actually costs more because there's just so much hurdle that they have to go through. They can only purchase certain kind of products. They can only purchase build in certain ways. So actually the per cost per unit becomes higher than if they did not worry about LIHTC and they just built.
Mm-hmm.
So yeah, go ahead. LIHTC is approved. It's always passed. It's got bipartisan support, but it will never, ever help us mitigate the housing crisis. It's just another way for lawmakers to get away by saying, I'm helping, aren't I? No, you're not. It's a Band-Aid. Okay, Jen, let's use healthcare. It's like you have a fractured leg, and instead of fixing up that bone, you put a little Band-Aid. Look.
Right? Yeah, we'll just tape it together.
Yeah. Let me tape it together. Yeah.
I'm glad that you went there, because now it makes more sense to me why you don't see as much affordable housing going up, why all these expensive apartment buildings are going up, because even if they wanted to go that route, it's so convoluted and costly.
Yes.
They're incentivized to make expensive places.
Mm-hmm.
I still think at its core, it's a good idea, but obviously there's problems with it that need to be resolved. It needs to be changed.
Yeah.
It needs to be changed. It needs to be more workable, more usable.
Yeah. So Matt, the best is for HUD to give federal funds to build housing units. That's it. And not say low income or market will adjust itself. If you have enough housing, you don't have to worry about low income housing or high income housing or et cetera, or luxury apartments. It will just adjust itself. Right now, like I said, $1,100 for a basement space, that should not even be a occupied space. That should not even be on the market. But because of the scarcity and the low inventory, it becomes an issue. And that's why then the landlords are keeping whatever units are there. People keep raising the prices. And that's where the corporate landlords come in. They come in, they buy up a whole apartment complex, multiple complexes, and Blackstone is known for doing that. BlackRock is known for doing it. And we're not going to say a certain person
who owns what.
We're not going to go there, Jen, another day.
A governor of some state.
Governor of some state apparently was on the board of.
Seems to be an awful lot of politicians involved. And owning stock in these companies that are making a ton of money.
And then we're like, now that.
And how many and there's a lot of that here in New Hampshire. We see that corporations buying up, like even that one Red Oak. They've bought like three family houses, because I've noticed their signs going up on 3-family houses.
And then they just little tweaks. So they do little tweaks. They change the stove out. They maybe put a laminate countertop, and they're like, oh, now the apartment is going to be $300 more or $500 more. Suddenly, okay, now it's considered mid-luxury apartments. Yes, exactly. So there are so many ways, Matt. If there's a will, there's a way. There is no will. There is no will.
No, there isn't.
The minimum wage is $7.25.
Minimum wage is still $7.25.
No, I feel a great sense of responsibility on that. It's just awful. It's awful. It's
and like, Jen, okay,
you can't rent an apartment on $7.25. You can't even eat on $7.25.
So Jen, when I was, so a lot of times people have hardships, and there was a time in my life when we were dirt poor. So, and back then the minimum wage was $4.25, and this is the early 1990s. Yes, about 1990s, mid 1990s. Minimum wage was $4.25. We worked 7 days a week. I had a morning job, I had an afternoon job, and I had an evening job. 7 days a week. You still. Oh my God, you are
scraping by, right?
Poor. You're just, yes, and there's no health insurance, there's no job security.
Like
I had a waitressing job. Okay, I'm sorry, it's not easy. Shout out to the servers. It is not easy.
Not at all, and their salary is even less.
Wiping down, and the kids keep spilling the milk, and you're cleaning out, and then they leave you little bits of money. It is, please. Be nice to servers. I was a server for a long time. It is a cruel job. Anyways, but where was I going with this? Oh, there's no job security and there's no health insurance, nothing. Yep. It's just a gig labor, right? And then sometimes you're really mistreated. Like I was told the bathroom had I think something happened, and I was told to go clean it. I'm like, I'm not going to go clean it. That's not my job. And the manager said, if you don't go clean it right now, you're fired. That's how they talk to you.
Yeah.
That's how they talk to you. I said, you can fire me. I was hired as not that, okay, I'm so sorry. Anyone who's a janitor, my heart goes out to you. It is so much work. It is such hardship.
Right.
But it's the way I was being treated by the manager, like threatened to be fired right away because there's no job security, and you're like, why don't you ask the others? Like, I wasn't sure if I was getting picked on. I don't know if it was a race thing, but anyways, but I was being asked, even though there were several other servers standing around. But anyways, who knows what was going on. But I do remember, what I remember was the way I was being treated. Listen to me or you're fired. How cruel.
Yeah.
Because they know you need the job.
Right.
Yep.
Right. Yeah.
Yep. I've had my share of really crappy jobs. We'll talk about those some other day. But
again,
because employers can feel like they can get away with it.
Yes.
Because what are you going to do? You need the work. You can't go home without a paycheck.
Mm-hmm. Can I touch on one thing Matt said earlier, but we have moved on from healthcare, but I wanted to touch on it.
Anything you want to talk about, go for it.
Matt touched on, like, we are always conditioned to feel that we still have the best healthcare system, and we have a great healthcare system, no doubt about it. If you have a certain amount of money and you have a certain job and your employer actually is able to afford a high quality health insurance company, I'm not going to name it, but there are some health insurance companies which are not as bloodsuckers as others.
Well, they get less bloodsuckery the more money you pay and the more Cadillac their plan is.
Well, yeah. As long as you remain an asset and not a liability.
And you're as an asset. Yeah. But we are always told, oh, no, don't look at this country or that country. Do you know when they need an MRI, they have to wait several months, et cetera, right? And we're like, oh, yeah, you know what? Okay. But let's talk about that for a second, because I used to also believe in that, like, story line.
Yeah.
In all those countries, if you ask, I don't want to name it, but say Canada or Germany,
sure,
you ask them and they will say, if somebody needs an MRI or a procedure and it's an emergency procedure, they will get it right away.
Oh, of course.
Yes. If it's a non-acute care, if it's a care that can be prolonged, then they are put on, they might be 2 months from now. But I'm so sorry. In America, even in the North Country, there are no more specialists left.
Right.
If you need an MRI, you have to go to Boston.
Right.
If your insurance lets you go over the border.
Yes. Like, you might have to go to Nashua or Salem or Portsmouth or Exeter Hospital. Or if your insurance, yes. So please, let's talk about that, because there are the providers are leaving New Hampshire.
Yeah.
100%. That's a very serious issue. And the reason we don't have more level 2, level 1 trauma centers, or level 2, I should say, is because we don't have the specialties required. You have to have neurosurgery. You have to have pediatrics, trauma. You have to have those things in order to have those higher levels of care. We don't have them because we don't have the specialists. And we're making med school impossible. Yeah. Oh, they're leaving the state in droves too, because they can't afford to practice here anymore.
Yeah. So therefore, when people criticize other healthcare systems, say, please, people, come on. Wait. Let's look what's going on in our state. When people need care, they're having to leave our state and go to Massachusetts.
Right.
Not cool.
It took me a year to get into my neurologist. I was on a waiting list for a year to go into my neurologist.
So see, those are the stories. So they're
right here. It's right here. So
that's always my first thought when I hear someone say, well, in such and such country, you have to wait. You can't, get everything right away. And it's like, so how is that any different from what we have here in the United States?
I will admit to you that I was one of those. I will admit, I was one of those people that bought into that. I really did think that they rationed care in Canada, and that must be why.
Yeah,
and I actually started having those conversations with people going, no, if my leg's broken, they're going to fix it.
Right.
They're going to do an MRI. No, if I have something and I could, you might have to wait for it. But we do that here. You might have to wait. When you get scheduled for an MRI around here, you might be waiting.
Yeah.
You don't instantly, and even in an emergency, you don't necessarily get in there. I got sent in for what they thought could be bad. Then they actually finally got around to the image. I was like this close to be in a really bad situation with 3 cervical discs into the spinal cord. But I waited way too long to get that MRI, walking around like that, here in good old America. I bet I might have gotten it faster in Canada.
I'm going to, my husband is walking in, so I'm just going to ask him to keep it low. I just texted him.
Oh yeah, yeah.
We're live right now. So,
Yes, yes.
But let's see. Okay, so we touched on healthcare. We touched on housing. We touched on corruption. I think we touched a little bit on corruption everywhere, right? The corruption in politics, the big money in politics. Yeah. We touched. So we are. I don't know what else you guys want to talk about, Matt. I mean, there's so much going on, and I talk to people. They're 24 or 25 in New Hampshire. They're working. They're on their parents' insurance. They're afraid to turn 26.
Yeah.
Let's talk about that. In the richest country in the world, which I'm going to become like a broken record, in the richest country in the world, in the richest country in the world, I'm going to become a broken record. A person who has has training and education, has done whatever needed to be done, was told if you do XYZ, you will live the American dream. They are now apparently living the American dream. And they're afraid to turn 26 because they have a job, but their jobs are not covering, not providing health insurance. That's another thing. Let's talk about that. In America.
Well, and the marketplace is expected to go up increasingly next year. Some of the numbers I'm seeing out there are pretty scary as to what's going to happen to the marketplace insurances. Medicare premiums are going up. They've already announced that. It was quite a bit too. Yeah, all of these things are going up even more next year. So everything you're saying is going to get worse.
Yes.
So we got to do, these midterm elections are vital in order for us to gain control on the Hill and stop the bleeding and curb some of the deaths that are going to occur from these. I'm not catastrophizing either. These are really horrible things that are going on. And I'm worried that a lot of people, there's going to be millions and millions of people that are going to lose health insurance next year because they're not going to be able to afford it off the marketplace anymore.
Right.
It's just going to be, because those tax subsidies for the working class, the current regime has gotten rid of.
Well, in effect, they've
extending the ones for the 1% that holds all the money in the country. When you talk about the richest country in the world, who's holding the most of the money is that 1%.
And yeah, go ahead.
I was just going to say, in effect, they have repealed the Affordable Care Act, just not the way they wanted to. They didn't do it all at once like they wanted to and make a big show of it. But little bit by bit, they've gutted it.
Yeah, they're
gutting Republicans used to admit there was some good stuff in there, like staying on the insurance until you're 26. Right. I mean, I remember when I turned 18, that was it. I had no health care.
Yeah.
That was it.
Yeah.
Because back in my day. But I remember you saying about the minimum. When I started my first healthcare job, I made $3 an hour, and I got a 10-cent raise when I became certified as a nursing assistant. And you think about that, and it's $7.25 now for minimum wage, and it's because we in New Hampshire screwed up. We got rid of our own minimum wage, and we married ourselves to the Fed. So unless the federal minimum wage changes, or the state of New Hampshire does something different, our minimum wage will never rise above $7.25. And in some of the poorest places in this country, that's what people are barely living on.
And I've met people who make $7.25 because a lot of times the lawmakers in New Hampshire will say, nobody in New Hampshire makes $7.25. Everyone makes 15 or 16 because of the McDonald's jobs. No, people in New Hampshire, some of them do make $7.25. And I've talked to them. Jen, it is heartbreaking when they get a little bill, like $25 bill, which was not expected. My God, that's like what?
It's definitely. Here's something I want to ask you about. So, and what that affects is homeless people, people who are unhoused. A lot of people who are unhoused have jobs.
Yeah.
They can't afford a place to live. So they're living in their car, or maybe they were living in a tent. But now we've criminalized being unhoused. And now they want to arrest people and put them in jail for being homeless or having a mental health issue. Like, how are you going? This is a huge issue. How do you plan to address this?
So first of all, we have to take away Donald Trump's pens that he keeps signing those executive orders. Somebody take those pens away, please. He keeps signing these insane executive orders that are so cruel.
Yeah.
We have not been kind to our most vulnerable people. We have not been kind to people who have mental health issues. We have not been kind to our veterans. We have not been kind to people who are suffering from substance use disorder. People, and a measure of a society is how you treat your most vulnerable, and we are failing over and over again. And we should not look at these people as, push them aside. No, these are human beings. They are down on their luck for many reasons, and we should help them. Again, housing. Where was I? Was it Norway? One of those Scandinavian countries. I was reading that they actually try to, instead of allowing homeless people like to fend for themselves and whatever, however, just pushing them under the rug, they actually have these housing models where they provide mental health counseling as well as a stable home, and then they allow and treatment, and then they slowly over time, because once you've been homeless for 5-10 years, you've basically checked out. You have the trust is gone. If you know why homeless people, you see them on the side, why they're sleeping in the morning and the daytime, because at night they're awake. They're awake to protect themselves. That is the most, where you're the most vulnerable at night if you want to sleep. So you don't sleep at night. That's why
I'm glad you said that, because a lot of people look at them and think, oh, they must be drugged or they must be drunk. No, it's like, nah, dude, this is the safest sleep they can get.
That's a good point. I never thought of that. I'm pretty empathetic, but that never even occurred to me. Yeah, that's a great point.
Yeah. And so we have to help. I mean, if we apparently have $200 million for a ballroom, if we have $1 billion for a plane that's not going to be even ready for another 4 years, we have trillions of dollars. Apparently, we are so rich, we can give trillions of dollars of tax cuts to
the patio. We paved the Rose Garden.
Yeah, we can pave the Rose Garden. We can spend
military parades,
and we have so much that we can spend. Like, we can fabricate stories about crime on our streets and send in the National Guards at a huge cost to the taxpayers. Apparently, we are such a rich nation, but not. Apparently, we're also not a rich nation. So, what is true? Which one is it? Do we have $1 billion for somebody's plane? Like,
we're retrofitting a Saudi Arabian plane. Let that sink in. And that's after his last term, when he redesigned the existing Air Force One that was just finished. But we can't house people. No, we can't provide mental health.
No, I mean, that one trip alone, not to just pick on the $1 million trips, because there's so much billions of dollars are getting wasted. So millions of dollars is like loose change now in the US government. But he went to, it wasn't some golf course in
Scotland to cut the ribbon on his own golf course.
Yeah.
Apparently we are really rich, Jen.
Yeah.
I'll tell you something. When I was overseas and that stuff was going on to build it, I never wanted to climb under a chair more in my life than when the screen filled up with this Scottish family talking about how horrible Trump's people were because they didn't want to sell their land. So they were blaring music and shining lights and harassing them and trying to force them out. And I wanted to climb under a chair. I was so like, oh my, like I'm in this other country watching this, like,
embarrassed.
This is horrible. This is our president. Oh my God, this is horrible.
You know, there's an episode of The Sopranos where Tony Soprano did something like that to make someone leave the house that they were in.
So basically, Matt, are you saying that
no?
No,
I'm just saying that just reminds me of an episode of The Sopranos where Tony Soprano engaged.
Maybe that's where they got the idea, for all you know.
A mobster. What? Yeah. Really, Matt? A mobster and the president, huh? You see some comparison. Wow.
Can you imagine if we actually had the ability in this moment to be able to snag that money back, and what amazing things could happen?
Jen, I want those pens.
Yeah.
I want those big markers.
What you gotta do, we need you elected, and then we need the Senate, and the House to create legislation to curb this. This is just, it shows you, I've never been a I've never been a person who likes executive orders for this very reason, for this very fear that it can be abused. Yes. And previous presidents have abused it. but not to this extreme.
No,
Now,
no.
I mean, to use the president's pen to criminalize human beings for existing in a park, in a tent, because that's literally all they have. What do you want people to do? At least in other countries, in India, China, they let people build makeshift houses. They're crappy places, but at least it's a roof over their head. They got warm food and a bed to sleep in. America won't even let that happen. And now we won't even let them put up a tent. Like, we won't let them have a space to just exist as a human.
It was heartbreaking to see. There was like in DC, they were like, the person would not leave his tent because that's his home, that's his livelihood, and they're dragging it off. I don't know if you guys watch those videos. It was just,
I've seen it here happening in our own, happening here where they're taking down the tents and they're forcing people out. Because that's happening right here at home too.
Oh, yeah.
It's happening all across the country, and they're so vile about it. Some of them, they'll take knives and they'll destroy things, so they can't use it. That's all this person has to their name. Whatever and you're stealing everything, because that's what it is. It's stealing. They're taking whatever clothing, whatever's in that tent. They literally will come down sometimes with those claws and just pick the whole thing up and drop it in a dumpster. Everything that was in it.
Think about
so dehuman. It's beyond dehumanizing.
I mean, so this is where cruelty is definitely trickling down from the White House.
Oh yeah, the cruelty is the point.
The cruelty is the point. Yes.
Yep, absolutely. They love it.
These midterms count big time. It's the only way that we're going to be able
to
save lives and change anything is to.
But not any Democrat, Jen. Not any.
No.
It has to be a Democrat.
I need a Democrat who's going to actually listen.
Yes.
When I tell you Medicare Advantage is killing people, I want you to hear our stories and really take it in. And don't send me a form letter saying, I like Medicare Advantage.
Yeah. No, Jen.
I can't have tone deaf. I need you to hear me.
These are public service jobs. We should not put our lawmakers in pedestals and be like, wow, they are so great. We can never be them. This is a public service job. Their job is to serve the public. If they are not serving the public, then please move on, go to do something else. Let someone who actually cares to serve the public, listen to the public, understand the problems, want to solve the problems, let them have that position.
Yes.
The other thing I want to tell you, one of the most important things in a public servant is, do you have a heart and do you have a soul? I mean, do you even care?
You have empathy.
Do you have, yes, empathy. Do you even care?
And do you ever just want to walk around with a mirror? Just be like, what do you see when you look at this?
Exactly. Yeah. But guys, I don't know if we're going to putting people to sleep now. It's 1 minute.
Yeah, we've gone for quite a while, but I really appreciate you giving me so much time.
I want you guys to call me.
I love this conversation
again, because we have to talk about so much.
Oh yeah.
We need to talk about the F word, the fascism.
Yep.
100%.
Yes. Let's not beat around the bush.
Right.
This is fascism. We are looking at a police state.
It is not a future. We are here. So let's talk about it. But I think I don't know. I want to let the poor listeners off.
No, I think this is probably a good, a bit over an hour, about an hour and 15 minutes, but we will definitely do this again in the near future if you'd like. I mean, this has been a great conversation. Karishma, do you want to mention your website again and anything else you want to make sure our listeners and viewers know about?
Thank you so much. So I launched last week. My website is actually you see it here, I think. Yeah.
Yes.
Oh, I was able to do that. KarishmaForSenate.com. KarishmaForSenate.com. I am from Exeter. I am a scientist. I'm running to basically help people. Housing crisis is out of control. Childcare crisis is out of control. Healthcare crisis is out of control. And we didn't touch on it, but our foreign policy is really bad. We are now committing genocide, or we're complicit in genocide in Gaza. We will touch on that. It is an heartbreaking situation. We are basically looking at the destruction of 2 million human lives. They're being tortured to death. They're being
100%.
starved to death, bombed to death. But we were
I
going to
am
talk
well
about.
aware you are a candidate for peace, and
I'm a
I think that's
candidate for peace.
very,
Yeah.
very important that we
I
have less
certainly-
warfare and more humanity in this world, right?
So please visit the website. Please sign up because we need grassroots support. Donate, please, whatever you can afford, $5, $10, whatever you can afford.
And you are not taking money.
Yes.
I think that's important for people to know.
Yes.
You really are a grassroots candidate. You are not accepting PAC money. And so this really is an effort of New Hampshireites who have a candidate who they want to really bring to the Senate to bring home up to that hill where it's not right now.
Yeah, corporate
We feel
PAC
like we're not getting heard and we
is
need to
really
be heard.
bad. Yeah. And then the other thing is, Jen, I'm actually on the board of Open Democracy Action, which was started by Granny D. Haddock. I am inspired by Granny D, who walked at age 89 from like California all the way to Washington, D.C. to get rid of big money. I am from Open Democracy. We are working day in, day out to expose the corruption in our politics.
An icon of New Hampshire.
Oh, yeah.
And I want to make sure our listeners know.
Yes.
I do want to make sure listeners know how to spell your name appropriately. It is Karishma, Karishma, for FOR, Senate, Senate.com, Karishma for Senate.com. Check it out, sign up because we need you.
Thank you so much. Thanks, Matt. Thanks, Jen. Please, it was a wonderful, thank you for talking about some very serious issues, but we need to talk about it. These are difficult topics, but we need to talk about it and we have to solve the problems. So thank you so much for having me today.
Absolutely. We will do this again in the near future. And thanks everybody for watching or listening to this edition of Matt Connarton Unleashed AF, as we call it, as it is the online only edition. And Jenny, thank you. And again, Karishma, thank you so much.
Thank you, guys. Thank you. Take care.
Bye, everybody.
Bye-bye.